Welcome back to the deep dive. Okay, today we're zeroing in. We've got these revision notes here, all focused on one specific condition.
That's right.
And our job really is to dive into just these notes, pull out the absolute must-know facts, the high-yield stuff, and, make it stick.
Exactly.
So if you're revising, maybe prepping for an exam, or you just want a really solid, quick understanding of this topic, then yeah, this one's for you.
Think of it as taking those potentially dense notes on nasal septal hematoma and just boiling them down. We'll cover the what, the why, the how it happens, and crucially, what you need to do about it.
Perfect. Making it memorable. So let's jump in. Nasal septal hematoma. Let's start right at the beginning. What exactly is it? Define it for us simply.
Okay, simplest terms. It's a collection of blood. But the key is where it collects its blood pooling within the nasal septum.
The septum being that wall in the middle of the nose?
Exactly. That wall of cartilage and bone separating your nostrils. So it's not just like a surface bruise. It's blood inside that dividing structure.
Got it. Blood inside the nasal wall. And the notes are pretty clear on how this usually happens, the cause, the etiology.
Yeah, the number one cause you need to remember is trauma, injury to the nose.
Right.
It's often linked with nasal fractures.
Yeah.
But importantly, you don't have to have a fracture to get one.
Ah.
The mechanism is, well, pretty straightforward. The trauma breaks or tears the small blood vessels within the septum itself. Those vessels bleed, and the blood gets trapped there, building up to form the hematoma.
So a knock to the nose, maybe not even a huge one, can pop those vessels inside the septum. Who's most likely to get this? Are there particular risk factors we should, keep in mind?
Absolutely. The notes list several key ones. Anyone involved in contact sports is a big one. Think rugby, boxing, martial arts.
Makes sense.
Accidents or falls are another major category,
Yeah.
especially relevant maybe in kids or older adults. Also, anyone who's had recent nasal surgery because, well, the septum's been worked on. Nasal foreign bodies could potentially cause enough trauma, and then you've got underlying medical issues, things that make you bleed more easily. So coagulopathies, or if you're taking anticoagulant meds like warfarin or the newer ones.
Okay, so anyone where a bit of trauma might just bleed more, or where the area is already compromised. So you've got the trauma, vessels break, blood pools in the septum. How does that pooling blood actually cause the problems, the pathophysiology?
Right, so trauma, vessel rupture, bleeding. The blood collects specifically between the cartilage of the septum and its covering membrane, the perichondrium.
Perichondrium, that sounds important.
It is. Very important.
Yeah.
Because that perichondrium, it's not just a wrapper. It's the main blood supply for the cartilage itself. Think of it as the cartilage's lifeline.
Okay.
So when that hematoma forms and grows, it physically lifts the perichondrium away from the cartilage.
Ah, okay, so it's not just sitting there passively, it's actively separating that vital layer.
Precisely. And the really critical consequence of that separation, functionally speaking, is it causes the septum to swell up significantly. And that swollen septum, it blocks the nasal passages. That's where the symptoms really start.
So blood collection pushes the blood supply away, causing swelling, leading to blockage.
Okay.
Got it. Which leads us perfectly to, well, what does this look like? What would you actually see, or what would a patient complain about? The clinical presentation.
Okay, the number one symptom, the notes really stress this, is nasal obstruction, blockage. It might be one-sided, but often it's bilateral because the septum's in the middle.
Right, affects both sides.
Yeah. The person will likely feel a sense of fullness or swelling right there in the middle of their nose. Pain or discomfort is common too. And because of the blockage, difficulty breathing through the nose is a major complaint. You might sometimes see nosebleeds, epistaxis as well.
So the quick thought is trauma plus blocked nose. That's a good starting point, even if the trauma seemed minor.
Absolutely. The notes explicitly say it can follow relatively minor trauma. Nasal obstruction is really the key symptom to flag it. Pain, maybe a runny nose, rhinorrhea can be there too. But while symptoms raise suspicion, it's the examination that usually nails the diagnosis. Yeah. And there's one finding here that is just critical, super high yield.
Okay, tell me, what's the crucial examination finding?
When you look inside the nose, maybe with an otoscope or a nasal speculum, you'll see this swelling coming from the septum. Often looks reddish or maybe purplish.
Right.
But here's the vital part, the thing to remember. You need to gently touch it, probe it. A nasal septal hematoma usually feels boggy. Boggy, like soft, squishy. It yields under gentle pressure. This is completely different from, say, a deviated septum, which feels firm, rigid. That boggy sensation is your big clue. Remember, trauma plus blocked nose plus boggy septal swelling. Think hematoma.
Boggy.
What?
Got it. Soft and squishy swelling on the septum after a knock. That's a really clear distinction. Okay, so you gently probe. If it's boggy after trauma plus blockage, suspicion skyrockets.
Right.
How often does this actually happen? What about epidemiology?
Yeah, the notes mention it's considered relatively rare overall, certainly in the UK,
Huh.
but you're obviously more likely to see it where nasal trauma is common. So after injuries in A&E, maybe sports clinics, that history of recent trauma is always the trigger to even think about it.
Okay, rare but important not to miss, especially with that trauma history. So you've seen the boggy swelling, got the history. What else could it be? What are the differential diagnoses?
Good point. Other things can cause nasal swelling. The notes list nasal fractures themselves, obviously.
Mm-hmm.
Maybe nasal cellulitis, that's an infection, usually painful. But the swelling tends to be firmer, more tender, not typically boggy.
Right.
Nasal tumors are on a list, though less likely acutely after trauma. Nasal polyps, usually paler, sort of grape-like, often linked to allergies, not trauma typically.
Mm-hmm.
Foreign bodies, especially in kids. And even things like severe allergic rhinitis. But honestly, that history of trauma plus the boggy feel on exam really helps cut through that list.
That boggy finding really is key then. So you suspect it. How do you confirm it? What investigations are usually needed?
Well, mostly it's a clinical diagnosis. Your examination, especially feeling that boggy swelling, is often enough.
Okay.
But if you need a better look, maybe see how far back it goes or check for other injuries, nasal endoscopy using that little camera can be really helpful.
Right.
And in some cases, perhaps if it's complex or you're worried about fractures or planning surgery, you might get imaging, like a CT scan of the nose and sinuses.
Yeah.
But the exam is usually primary for the diagnosis itself.
Exam first, maybe scope or scan if needed. Okay. We've covered what it is, the causes, how it develops, what it looks like, differentials, diagnosis. Now, the really crucial bit, management. What needs doing? And you mentioned urgency earlier.
Absolute urgency. This is critical. You must manage this promptly. The key is evacuation. You need to get that blood out and quickly. It can't wait.
Prompt evacuation. How's that done?
It means draining the hematoma.
Yeah.
The standard treatment is incision and drainage IND, usually done by an ENT specialist. They make a small cut in the lining over the hematoma and drain the blood.
Okay.
And importantly, after draining it, the notes mention placing nasal packing or sometimes a bolster stitch. The idea is to press that perichondrium back against the cartilage so it can stick down again and restore the blood supply.
Drain it, then pack it to push things back together. Anything else needed?
Yes. Antibiotics? The notes specify intravenous antibiotics, usually.
Yeah.
That collection of blood is just asking for infection, so preventing an abscess is crucial.
So drain, pack, antibiotics. And you really stress the urgency. Why? What's the big danger if this is missed or delayed?
This is the consequence you absolutely have to remember. This is why it's an emergency. If that hematoma sits there, lifting the perichondrium off the cartilage, remember, that's the cartilage's blood supply.
Yeah, the lifeline.
If it's cut off for too long, the cartilage dies. It undergoes necrosis.
Right.
And the time frame in the notes is frighteningly short. Septal cartilage necrosis can happen in as little as 3 to 4 days.
3 to 4 days. Wow. That is incredibly fast for tissue death. Necrosis meaning it's gone permanently.
Exactly. Irreversible damage. Once that cartilage dies, it doesn't regenerate. And if the main structural support of the septum dies and collapses, well, that leads to the really serious permanent problems.
Like the saddle nose look you sometimes hear about.
Precisely that. Septal cartilage necrosis is what leads to the collapse of the nasal bridge, causing that characteristic saddle nose deformity. Or it can cause a septal perforation, basically, a hole straight through the middle wall of the nose.
A hole, what does that cause?
That can lead to chronic crusting, sometimes a whistling sound when breathing, persistent blockage, just ongoing problems.
Wow. So a blocked nose after a knock, if missed, can lead to permanent facial deformity or a hole in your septum within just a few days. That really underscores why spotting it and acting fast is so critical.
It absolutely does. Missing this has major consequences, which logically leads to prognosis. Given this potential for rapid disaster, what's the outlook if it is caught and treated properly?
Well, the good news, according to the notes, is that the prognosis is generally good if you get timely diagnosis and appropriate treatment. Drain it early, let that perichondrium reattach, prevent infection, and the septum usually heals well. Early action equals good outcome.
Right. It's one of those conditions where delay is really damaging, but prompt action usually leads to a good result.
Let's just quickly hammer home those complications again.
Right.
What are the specific bad outcomes listed if it's not managed well?
Okay, the key complications from untreated or delayed treatment are 1. septal cartilage necrosis, the cartilage dying. 2, which then leads to nasal deformity like the saddle nose or a septal perforation, that hole. 3, chronic nasal obstruction down the line, maybe from scarring. 4, infection developing into a septal abscess pus collecting, which is even worse. And 5, potentially sinusitis because the drainage is all messed up.
Okay, necrosis, deformity, perforation, chronic blockage, infection, sinusitis. All roads lead back to needing that prompt drainage and antibiotics. It really drives home needing to think about this diagnosis whenever someone comes in with nasal symptoms after any kind of trauma.
Exactly. It's a perfect example of where a specific, careful examination, finding that body feel, can totally change the patient's outcome.
Yeah. What a journey through these notes. We've gone from the basic definition, blood inside the septum, understanding how trauma causes it, how that collection lifts off the vital perichondrium, leading to that telltale boggy swelling. We've covered the main symptom of blockage, the crucial exam finding, risk factors, differentials, and most critically, the urgent need for drainage and antibiotics to stop cartilage death, and those awful complications like saddle nose or perforation, which can set in within just 3 or 4 days.
It really is a condition that highlights the power of good clinical skills, history, and examination, and the importance of knowing about time-critical conditions. That short time frame for necrosis is the key takeaway.
It absolutely is. And thinking about that, here's a final thought for you, the listener, to maybe mull over. Given how fast permanent damage can happen with nasal septal hematoma, that really stark 3 to 4 day window for cartilage dying, what practical steps or maybe, system checks could be useful in places that see nasal trauma, even minor trauma? How do we make sure that crucial boggy swelling isn't missed? How can we build in safeguards to catch this urgent diagnosis every single time? Something to reflect on.
That's a really important question for clinical practice. Vigilance and knowing what to look and feel for is paramount.
Well, thank you for joining us on this very focused deep dive. We really hope breaking down these notes on nasal septal hematoma has made it clearer, more high yield, and easier to remember, especially if you are revising or just needed a solid refresher.
Yes. Hope it was helpful. All the best with any exams or clinical work.
And just a reminder, if you are looking for more high-yield revision materials, particularly things like practice questions, which are so useful, you can find resources over at passthemsra.com and also freemsra.com. Worth checking out.
Definitely worth a look.
Thanks again for tuning in to The Deep Dive. We'll catch you on the next one.